Why does pale stool lag after dark urine in obstructive jaundice? Okay, so before we answer the question, we will recap back about the bilirubin metabolism.
So we start with a brief introduction on the bilirubin metabolisms. The bilirubin metabolisms start with a red blood cell which has a lifespan of approximately 120 days. After they completed their life cycles, they are destroyed in organs like spleen and liver that contains lots of macrophages. They releases hemoglobin within the red blood cells. The hemoglobin is then split into heme component and globin component. The globin component is converted into amino acids and utilized in the body. The heme component converted into iron and biliverdin, and this reaction is catalyzed by the enzyme called as heme oxygenase. In the next step, the biliverdin is converted into the yellow compound called as the bilirubin, and this action is catalyzed by the enzyme biliverdin reductase. This bilirubin so form is in the unconjugated form, which is non-water soluble form. So it requires albumin for it to transport to the liver. In the liver, the bilirubin is converted into conjugated form, which is water soluble, and this reaction takes place by the combination of glucuronic acid with unconjugated bilirubin. It is then transported to the biliary channels into the duodenum, and through the duodenum it reaches the colon. In the colon, the bilirubin is acted upon by a number of microorganisms and is converted into urobilinogen and stercobilinogen. Majority of these compounds are excreted in the feces in the form of stercobilin, which imparts the yellow color to the feces. But 10 to 15% of these compounds are reabsorbed into the blood, and some part of that reaches the liver, and this is known as enterohepatic circulation. A few percentages of the reabsorbed compound reach the kidney, and they are excreted in the urine in the form of urobilin. For OJ or obstructive jaundice, this is basically where something blocks the flow of the bowel, which can cause from anything from the gallstones, pancreatic, CA, and also cholangiocarcinoma. And this blockage causes the pressure in the bowel duct to increase, which literally causes the bowel to leak. And the bowel is not the only things to be leaked out. It includes bile salts, and also bile acid can also get into the blood, and that excess conjugated bilirubin is excreted in the urine since it is water soluble, which again leads to dark color urine. And also, since lots of biles are losing, fats also won't be able to absorb as well, which cause ones to excrete tons of fat called as steroria.
So, to answer the question, why does pale stool lag after dark urine in obstructive jaundice, we have to know the basic physiology of passing stool and also urine. For urine, we usually pass urine several times daily, which every time the bladder reaches of about 300 ml. But for passing motion, it only takes once a day or usually during alternate days. So for example, if patient have a stone in the common bile duct which decides to obstruct the distal part at 10 a.m., our liver will perpetually discharge soluble conjugated bilirubin after 10 a.m. So the bile will accumulate, and within an hour, by 11 a.m., the amount of serum bilirubin will be doubled. So what happens is, this soluble bilirubin, it will leach across our renal glomerulus and into the urine. And eventually, the bilirubin-rich urine, it will accumulate in the bladder. So, as the hours pass by, more trapped bile will upstream of the obstructing common bile duct stone. It will cause gradual rise in serum conjugated bilirubin, and the urine will get increasingly darker. And by noon, you will pass urine for the first time will look darker than usual, but probably just a shade darker to you. But by the time you pee again at about 7 p.m., it will be tea-colored urine.
Noise and content of the stercobilin. So, when the obstruction occurs at 10 a.m., the stool that is made from the duodenal will receive the zero bile, which means it's no bilirubin, zero bilirubin. So, the bacteria at 10 a.m. onward will cannot make a new stercobilin or cannot produce any stercobilin. Therefore, this post 10 a.m. stool will become pale stool later when you excrete it. So on the next morning or the second day around 10 a.m., we already has passed our urine about 5 times or more, which is increasingly in the color of the urine. But if we pass motion, the stool color is remain brown because the stool is come from the descending and transverse colon, which is before the post obstructed. So the color of the stool in the second day will remain brown in color. But when we pass motion on the third or fourth day, the color of the stool will change. It become more pale. In conclusion, the pale stool will lag behind the dark urine at least a minimum of 24 hours or longer.